Chris, Scrubby MD. So, for today's topic, let's talk about Parkinsonism. So, Parkinsonism is a syndrome that composed of three characteristics or three cardinal features. First would be you must have your tremors. Second would be rigidity. And then the third would be bradykinesia. For rigidity, we have two types of rigidity. The one wherein there is an alternation of relaxation and rigidity. Okay, that is what we call your cogwheel rigidity. The second one would be your lead pipe rigidity, which is characterized by a stiff movement of the passive movement of the arm, usually at the upper extremities or even at the lower extremities. That would display as a slow movement. Kasi bagal kung ano to, mahirap yung free movement niya. Okay? Next feature pala. The next feature would be what we call tremors. Okay? According to the International Parkinsonism Movement Disorder Society, tremors can be classified whether or not is it from an action tremor or a resting tremor. For Parkinson's disease or Parkinsonism, usually it's more of a resting tremor. Okay, resting tremor meaning you're not moving or di mo ginagalaw yung kamay. Okay, saka siya nagkakaroon ng tremors o nag-exhibit ng tremors. Yung tremors, they disappear or nawawala siya kapag nagagalaw mo yung extremity. Okay, that is resting tremors. Kinetic tremors naman, kahit gumagalaw ka, nagkakaroon siya ng tremors. Sorry for that. Now, natapos natin yung tremors, no? For the third part would be your bradykinesia. Bradykinesia is slow movement or diminished movement ng isang pasyente may Parkinson's disease or Parkinsonism. So the slow movement is usually a problem with regards to motor function. Ang Parkinson's disease kasi, it is usually diagnosed clinically, meaning based on physical examination and the presentation of the cardinal features. Kaso lang, the confirmatory test for or to confirm that the patient has Parkinson's disease, it is usually by autopsy. Okay? Pero since may mga advancement na tayo with modern medicine, okay, Parkinson's disease can be diagnosed safely through clinical diagnosis as well as supramental imaging. Okay? Nakikita natin, madali na natin i-visualize ang dopaminergic pathways kasi ang main problem ng Parkinson's disease is the diminished or mababa ang dopamine sa brain, particularly sa area na substantia nigra compacta or pars compacta. Okay? Maliban doon, syempre, ang Parkinson's disease also diminished yung areas na mayroon ding mga dopamine neurons or dopaminergic neurons na nagproduce ng dopamine maliban doon. Aside from that, Parkinson's disease kasi it's considered as the primary form of Parkinsonism which is idiopathic. Okay? Pero meron din tayong mga other causes of Parkinsonism or what we call your secondary Parkinsonism. Secondary Parkinsonism naman, we have what we call a lot of entities that would cause secondary Parkinsonism. One would be vascular or yung pumapasok ang stroke, particularly sa basal ganglia or sa cerebellum. Nasisira na kasi yung basal ganglia, yung pathways with regards to motor function, yung nagkakaroon ng tremors like your palatothalamic, striatopalaan, wait lang, basta mga pathways doon. Next also would be kung may mass, okay, or a brain tumor na nag-i-impinge dun sa areas which are rich in dopamine neurons. Okay, yung compression, maapektuhan din yung circulation at saka yung nutrition ng neurons sa brain. So kapag may compression, like may meningioma, naapektuhan niya yung Monroe-Kelly doctrine natin, which is yung balance between blood, brain, and CSF. Also magkakaroon ka ng balance doon kung kulang sa blood, ischemic, or magkakaroon ng pure nutritional source, as well as yung poor CSF flow kasi meron din yung nutrition doon. And then yung tissues, okay, yung brain, doon nang gagaling yung neurons. Kung nagka-compress yun, mawawalan ng function. So kung mangyayari yun sa area like yung sa substantia nigra, makakompress, mawawalan ng normal function, or sa basal ganglia, mag-represent with Parkinsonian features like your tremors, rigidity, and bradykinesia. Maliban dyan, pwede rin mga stroke medications. So kung drug-induced Parkinsonism ito, it is usually due to side effects of antipsychotic medication. Yung mga pinaka-common na that would cause Parkinsonism, okay, drug-induced or secondary Parkinsonism medications are your first line antipsychotics and second line antipsychotics. Now, kailangan naman kasi siya kapag psychotic mga patients with psychiatric illnesses kasi they are the ones that would regulate, okay, the symptoms of their illnesses. Kaya hindi mo dapat iwasan, okay? You just have to be more of a hands-on sa consultations mo with your doctor and your psychiatrist para maiwasan natin. Nagpe-present kasi ang mga antipsychotic patients with Parkinsonian features similar with your EPS or extrapyramidal features or symptoms. Kaya dapat nababantayan siya closely with your psychiatrist and also even your family physicians. Okay? So drugs, meron din tinatawag na toxic-induced. Rarely nagkakaroon tayo dyan. Ang mga nakikita causes would be yung excessive manganese and iron, pero they rarely present with that. Mas common pa rin ang drugs at mas common pa rin ang vascular like yung stroke at saka even brain tumors. Okay? So, yun lang yung mga secondary cause. Meron din tayong mga atypical, pero i-consider lang natin ang atypical Parkinsonism kapag, let's say, nag-start ng tayo ng treatment. So, yung treatment ng Parkinson's disease, okay, hindi gumana. The usual treatment is usually giving your levodopa. Pag hindi siya gumana, kahit naka-max out yung levodopa for treatment ng Parkinson's disease, magko-consider na kami ng atypical Parkinsonism. So, mga atypical Parkinsonism, mas maganda sana sa ibang video yun. Yung multiple systemic atrophy, PSP, and also other rare conditions that would cause atypical Parkinsonism. So, hanggang doon lang naman yung ginawa kong video. I hope mabilis lang siya kasi ikon lang to from duty ako. Anyway, like, share, and subscribe na lang. And sorry, from English to Tagalog. Di ba? At least nakakapag-post. So, thank you for watching and I hope to see you on the next one. Bye.